Dear friends, dear colleagues, this time in our dental tips we will speak about a very interesting topic that is related to function and occlusion, and actually it is completely about palatal inclination angles and how it influences the dynamic and static function. Speaking about the correlation between the angle of the condylar inclination angle and with the palatal inclination of the central incisor and the canine. And we were speaking that the maximum steepness has to be 55 degrees, but in our case that I'm sharing with you, we have 64 and 57. That means that these central incisors every day act as interference. So actually, masticatory system, the poor mandible with a restricted envelope of function gets this interference, and we have every day we have pushing, kicking, punching, everything what you can imagine to these frontal teeth, and then you can get recessions. You can get tooth wear, which is actually very visible on his lower teeth. By the way, look at his lower teeth, and also we have the tooth wear of upper teeth from the palatal surface. Maybe you can see it from this perspective. And that's one of the reasons of the recession. So basically you can do your preparations very well. You can do your cementation very well. Your veneers or crowns can be integrated into the biologic environment. Best fit, perfect transition, no cement, everything is super polished. But you may still have recession later on, not because of your retraction, not because of your rubidium isolation, but because of the steep angle of the palatal surface of the front teeth that may act as interference. So basically we have to check these parameters in these kind of cases, especially when you do full mouth rehabilitation, especially when you do veneer case, especially when you would like to make teeth longer aesthetic wise. So this is what you have to check, my friends, because that's super important. And here what you can see, we can see here after this is full mouth rehabilitation case, and that's the part of the wax up prior final restorations, and we changed the palatal angulation by doing preparation and by doing this 360 veneers, if you want to call it, or crowns or semi-crowns, and we have now 55 degrees, so we can actually say that these restorations will guide the mandible. So we will have guidance, we will have movements, slight movements, so we will not have interference. So that's the result straight after cementation, and here we have before and after in that kind of big reconstructive cases where a lot of things have to be calculated. So that's the big topic about recessions, retractions, and also inclination of the palatal angle of our teeth. Okay, if you are interested in that, my friends, I would like to make some kind of advertisement. If you don't mind, I would like to introduce you or to invite you to attend our functional course that will be in March, and we will do it also in a regular basis here in our webpage, which is BeloGrad.com. You can find the functional diagnostics and treatment planning course, where you will be able to see everything live. You will be able to see step-by-step diagnostic procedures, and we are speaking how we measure all these angles and how we measure everything related to the functional things that we have to take into consideration in big cases. Hope this information was useful. I know that it's maybe complicated, maybe difficult somehow, but it is very important for us to understand these principles in occlusion to make our cases more predictable. Stay in touch, and may the dental force be with you.